Thalassemia is a genetic blood disorder that affects millions of people around the world. It is a condition that is inherited from one's parents and can have serious health implications if not properly managed. The disorder primarily impacts the body's ability to produce hemoglobin, a crucial protein in red blood cells. Hemoglobin is essential because it is the protein in red blood cells that binds to oxygen. It carries oxygen from the lungs to all parts of the body, ensuring that tissues and organs function properly. People with thalassemia have a reduced amount of hemoglobin, which means their red blood cells cannot carry enough oxygen. This deficiency can lead to a variety of health problems, including fatigue, weakness, and more severe complications like organ damage. Thalassemia is a global health concern, affecting millions of people worldwide, particularly in regions like the Mediterranean, Middle East, and South Asia. Understanding this condition is crucial for early detection and proper management, which can significantly improve the quality of life for those affected. This essay will delve into the types, implications, and care associated with thalassemia. There are two main types of thalassemia, alpha and beta, each with varying degrees of severity. Thalassemia is often inherited, meaning it is passed down from parents to their children through genes. If one or both parents carry the thalassemia gene, their child may inherit the condition, which can range from mild to severe. The severity of thalassemia varies depending on the type and how many genes are affected. Proper medical care and regular monitoring are essential for managing the condition effectively. Our genes play a vital role in how our bodies function. They are the fundamental units of heredity, carrying the instructions that dictate everything from our physical appearance to our susceptibility to certain diseases. They are like blueprints that determine our traits, including our health. Each gene contains specific sequences of DNA that encode the information necessary for building and maintaining our bodies. Thalassemia arises from mutations in these genes, specifically those responsible for producing hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen from our lungs to the rest of our body. Hemoglobin is made up of two types of protein chains, alpha and beta. These chains must be produced in the correct amounts for hemoglobin to function properly. These chains are crucial for binding oxygen and transporting it throughout the body. Without properly functioning hemoglobin, our cells would not receive the oxygen they need to produce energy. In thalassemia, mutations disrupt the production of either the alpha or beta chains, leading to an imbalance. This imbalance causes the red blood cells to be less effective at transporting oxygen. The severity of thalassemia depends on the number of gene mutations inherited. The more mutations present, the more severe the condition can be. Individuals with one mutated gene may have mild or no symptoms, often going undiagnosed or being mistaken for other mild conditions, while those with mutations in both copies of the gene experience more significant health problems. These can include severe anemia, fatigue, and other complications that require ongoing medical care and treatment. Thalassemia is broadly classified into two main types, alpha thalassemia and beta thalassemia. These classifications are based on which hemoglobin chain is affected by the gene mutation. Alpha thalassemia involves mutations in the genes responsible for the alpha-globin chains. The severity depends on the number of affected alpha-globin genes, ranging from silent carriers to severe forms like hemoglobin H disease. Beta thalassemia involves mutations in the beta-globin gene, leading to reduced or absent beta-globin chain production. This type is further classified into beta thalassemia minor, also known as the trait, and beta thalassemia major, or Cooley's anemia. The health implications of thalassemia vary widely depending on the type and severity. Mild forms may cause mild anemia, while severe cases can lead to life-threatening complications. Common symptoms of thalassemia include fatigue, weakness, pale skin, and shortness of breath. These symptoms arise from the reduced oxygen-carrying capacity of the blood due to low hemoglobin levels. Untreated thalassemia can lead to complications such as iron overload, bone deformities, delayed growth, and an enlarged spleen. Iron overload is a serious complication that can damage organs like the heart and liver. Section 5. Diagnosing thalassemia, tests, and procedures. Early diagnosis of thalassemia is crucial for effective management and preventing complications. Diagnosis typically involves a combination of blood tests and genetic testing. A complete blood count, or CBC, is often the first step in diagnosing thalassemia. This test measures various components of the blood, including hemoglobin levels and red blood cell size and shape. Hemoglobin electrophoresis is another important test that separates different types of hemoglobin in the blood. This helps identify the specific type of thalassemia and its severity. Genetic testing confirms the diagnosis and identifies the specific gene mutations involved. Section 6. Medical management of thalassemia. The management of thalassemia aims to alleviate symptoms, prevent complications, and improve quality of life. Treatment plans are individualized based on the type and severity of the condition. Regular blood transfusions are the cornerstone of treatment for moderate to severe thalassemia. These transfusions help maintain adequate hemoglobin levels and reduce the need for the body to produce its own red blood cells. Iron chelation therapy is crucial for managing iron overload, a common complication of frequent blood transfusions. This therapy involves medications that bind to excess iron in the body and help remove it. Section 7. Living with thalassemia, lifestyle adaptations. Living with thalassemia often requires lifestyle adaptations to manage the condition and maintain overall well-being. These adaptations encompass various aspects of daily life, including diet, exercise, and emotional well-being. Maintaining a balanced and nutritious diet is essential for individuals with thalassemia. A diet rich in fruits, vegetables, and whole grains provides essential nutrients and supports overall health. Regular physical activity, tailored to individual capabilities, is encouraged for overall health and well-being. However, it's essential to consult with a healthcare professional to determine the appropriate level and type of exercise. Section 8. The importance of diet in thalassemia management. Diet plays a crucial role in managing thalassemia and preventing complications. A well-balanced diet provides essential nutrients while also addressing specific needs related to the condition. Iron intake is a critical consideration for individuals with thalassemia. While iron is essential for red blood cell production, excessive iron absorption from the diet can worsen iron overload in those receiving regular blood transfusions. Calcium and vitamin D are crucial for bone health, especially for individuals with thalassemia who may be at risk of osteoporosis. Incorporating calcium-rich foods and ensuring adequate vitamin D levels are essential. Section 9. Support systems and resources for thalassemia. Navigating the challenges of thalassemia can be demanding, but a strong support system and access to resources can make a significant difference in the lives of individuals and families affected by the condition. Support groups provide a platform for individuals with thalassemia and their families to connect, share experiences, and offer each other emotional support. These groups often provide valuable information, resources, and a sense of community. Thalassemia organizations play a vital role in raising awareness, advocating for research, and providing educational materials and support services to affected individuals and their families. These organizations serve as valuable resources for information, guidance, and advocacy. Section 10. Living a full life with thalassemia. Living with thalassemia presents unique challenges, but it's essential to remember that it doesn't define a person's life. Each individual has the potential to overcome these obstacles with the right mindset and resources. With proper management, support, and a positive outlook, individuals with thalassemia can lead fulfilling and meaningful lives. Support from family, friends, and healthcare professionals plays a crucial role in this journey. Advances in medical care have significantly improved the life expectancy and quality of life for people with thalassemia. These advancements include new treatments and therapies that are continually being developed. Regular blood transfusions, iron chelation therapy, and other advancements have made it possible for individuals with the condition to thrive. These treatments help manage symptoms and prevent complications. It's crucial for individuals with thalassemia to prioritize their physical and emotional well-being. This includes regular medical checkups, a balanced diet, and mental health support. Engaging in hobbies, pursuing education and career goals, and maintaining strong social connections contribute to a fulfilling and meaningful life. These activities provide a sense of normalcy and joy, which are essential for overall well-being. Section 11. Conclusion, awareness, care, and a brighter future. Thalassemia is a complex genetic blood disorder that requires lifelong management. Early diagnosis, appropriate medical care, and lifestyle adaptations are crucial for preventing complications and improving the quality of life for individuals with this condition. Raising awareness about thalassemia is paramount. Educating the public, healthcare professionals, and policymakers about this condition can lead to earlier diagnosis, better treatment options, and improved support for those affected. Continued research into thalassemia is essential for developing new and innovative treatments, ultimately aiming for a cure. Gene therapy and other cutting-edge approaches hold promise for the future of thalassemia treatment and management.